Let me join DPM Wong in re-emphasizing that I think we are certainly much better prepared than 6 years ago, but we must not be complacent for the simple reason that this Mexican swine flu is not the same as the SARS virus that we had to deal with last time. I think we did well last time, but there was an old war. This is a new war now, and we have to adapt our approach to face this new enemy. And in many ways, this new enemy is much more difficult than SARS. I would stress 3 points on why it is different and more challenging to deal with. I think first, this swine flu is a lot more contagious. You look at how fast it has spread around the world to several countries now, and the speed of spread. And secondly, as you heard from the earlier technical briefing, that unlike SARS, patients can be infectious even before symptoms appear. So what this means is that border control cannot be foolproof. It does not mean that there's no value in border control with temperature screening, because it will still allow us to at least pick up those who are already feverish, but it is not foolproof. So there will be leakages through the borders. And I think third complication of the flu pandemic is that historically it tends to come in waves. So remember SARS, we had a big fright, and we won the battle, and it just quietly fade away. Whereas flu pandemic, unfortunately, has a habit of coming in waves, and sometimes the initial waves may look mild, so your guts are down, and then the second wave can then be quite lethal. So this third difference means that dealing with this swine flu pandemic is likely to be long drawn. I think we must be mentally, physically, psychologically prepared for a long haul. So it is not a one quick battle and then we move on. Of course, at the same time, fortunately, I think with the SARS experience, the world is in a much better position to deal with this new enemy. I mean, in two ways. For example, I think the world, especially the government and the hospitals and scientists, are much more networked now operationally, and with WHO providing very good and sound leadership. And secondly is, in the last 6 years, I think the scientific laboratory capabilities have been enhanced significantly. You just look at, over the weekend, the genome of the virus was deciphered and published on the website. The importance and advantage of that prompt action means the scientific community and the pharmaceutical researchers can then proceed to get on with their research work, and hopefully within the next few months go into commercial production. So I think those are the key changes between SARS and the swine flu. The bottom line is this is a very dynamic situation, but it does not mean that a global pandemic with very high death rate, as what happened 90 years ago, is inevitable. It may happen, then again it may not. A lot depends on how the world responds to it. I think if countries and the people within the countries work hard together, cooperate, and do what is right, we may be able to reduce the casualties and the fatality. I joined DPM Wong in alerting Singaporeans that while today we may have no confirmed cases yet, but we are such a global city that you are plugged into the whole jet airline network, that it's a matter of time when some of the cases, maybe without fever, presentation, just walk across our borders. And the next moment they'll be in our community, and they may start causing local clusters. I can only appeal to those patients who have fevers to be, I think, act on the side of caution, that if you feel feverish, coughing, sneezing, I think immediately get in touch with your doctors. And if it is confirmed or suspect to be swine flu, at least quite unlike SARS, now there are medication for it. The studies suggest so far that Tamiflu and Relenza are reasonably effective, provided the treatment commences as soon as possible, preferably within 48 hours of the symptoms. So if you have those symptoms, you may not know whether it is swine flu or not, doesn't matter. I think come forward to see your doctor and let us assess it, and Tamiflu is available. The government has enough stock of Tamiflu to deal with the patients that are expected to crop up. So I think what is likely going forward in this part of the world as well is that you may begin to hear local clusters. And I think we should not be unduly shocked if it happens, because it may very well happen. For all we know, even as we speak, there may already be such patients inside in the community. So the response strategy must be to try to minimize casualties, minimize fatality. So far, if you look at the situation outside of Mexico, the cases look mild, meaning there is, as I said, no fatality, and the illness outside of Mexico seems self-limiting. I mean, there can be many explanations for this, and scientists, of course, are trying to figure out why this huge difference between high fatality rate in Mexico versus mild situation outside. One optimistic interpretation is that viruses tend to attenuate and become weaker as with each round of transmission, and probably that's what's happening here. But if it happened that way, then what it means is there will be many patients who may be infected, but the risk of death may not be as high as what we observe in Mexico. But as I said, there are a lot of unknowns to what is happening, because this is still an evolving, dynamic situation. Key point is, I think, all hands on deck. That is, certainly on the hospital side, we will act much more cautiously than necessary. So although you talk about color coding from yellow, from green to yellow and orange, in practice, in the hospitals, we have moved into yellow even days before we declare so. And that will always be the case. So, for example, even today, we are start looking at, for hospitals, maybe some of the orange procedures have to be put in place. So I think that is how we should react. I think for Singaporeans, we have an important role to play. So I joined DPM Wong in asking Singaporeans maintain a high standard of personal hygiene, wash hands frequently, and if you cough or sneeze, please use tissue paper, cover your mouth and nose. If you are sick, see a doctor immediately, listen to the advice, and stay at home. So that you do not spread the disease to outsiders, to other people. That way we protect everybody all around. And that way I think we can help to minimize fatality and casualties. Thank you.